And News Today continues.
Well, welcome back, everyone. Now, we are here once again with our bi-weekly segment, Nutritional Brain Health, with neurologist Dr. Maljars. Thank you again for joining us this week.
Thank you.
All right, now, we've talked a lot about nutritional brain health. Now, can you summarize what we have discussed so far?
Yeah, in general, I'm sort of trying to make the point that Alzheimer's, the most common form of dementia, is not necessarily something that kind of hangs over our head as we get older and may or may not happen to us, but it's actually something that's a result of multiple lifestyle factors that we can actually change. And the biggest one of those is what we eat, what gets into our body, mainly, of course, through what we're eating.
I know we've talked a lot about how nutrition affects your overall health. Now, can you give a quick little summary of what you should and should not eat?
Yes, the sort of general categories, there's a lot of different diets out there. Obviously, there's a lot of different fads and all that sort of stuff, but the general categories are, this is how I try to make it simple for my patients especially. The first rule is the food we eat should actually occur in nature, right? So it should be something that actually comes from the natural world, like an egg, as opposed to something that, is made in a factory, like, Little Debbie's or something, to name 1,000 other things like that. So that's the kind of the first rule of thumb. And then there's sort of 3 categories of food that if we could avoid, we would do wonders for our overall health and our brain health. And those 3 categories are sugar and all artificial sweeteners. The second category is refined carbohydrates, so flour, white rice, regular potatoes, so just kind of simple refined carbs. And the third thing is seed oils, seed and vegetable oils like canola, soybean, corn oil, vegetable oil. And the reason why those are problematic, those oils, is because they require, a 17 steps in a factory to be made, and they're very inflammatory and that sort of thing. So if we could avoid those 3 groups of types of food in our diet, which, by the way, is 70% of the grocery store has at least one of those things, if not all 3. That's sort of the big picture of what to avoid eating.
That's really crazy, especially now day and age, just a lot of fast food, just quick and easy. I know my kids, they don't want to eat nothing healthy. It's chicken nuggets or macaroni. Exactly.
The whole system, is and they're seeing the ads for that, and it's the most accessible thing. It's the cheapest thing often. It's the whole system is very much against you if you want to stop eating those three types of food.
It's very true, and it's quick and easy, and it keeps them from yelling.
Exactly, yeah.
Now, I know we have discussed foods to avoid and things that we should eat, but what about some supplements?
Supplements can be really helpful for brain health. There's again a whole bunch of supplements out there, and a lot of them can be very, very good options. But the couple that I recommend to my patients are coconut oil. Is very cheap. It's very simply made. It's not processed, and it's very good for your brain. There was a study a couple years ago that showed that people with Alzheimer's actually, by doing nothing else except for eating 2 tablespoons of coconut oil a day, did better on cognitive testing. They were testing their cognition, and they did better. So coconut oil. Fish oil is good, so a good quality brand fish oil. Fish oil is good for our brains. And actually, turmeric, or curcumin, which is the active ingredient, turmeric is another good option that I recommend for people. There are many other supplements out there. I usually recommend that folks check with a provider who's kind of open to the idea of supplements before they try something. But those are some simple ones.
I would never think to use supplements.
It's important, we're often very deficient in our diets in terms of, there's even, sometimes just a good quality B complex vitamin is enough to give your brain, what it needs. And the whole goal here is kind of 2-pronged, right? It's to stop giving our brains things that make it want to protect itself against, kind of hunker down and protect and start to sacrifice higher level thinking, and to give it things that it needs to flourish. So supplements can be a very important source of that. And then, of course, the types of food that we're eating.
That's insane. Is there anything else that you would recommend?
There's a lot of different other factors that can go into optimizing your brain health. Exercise is probably the next biggest, low-hanging fruit. We live sedentary lifestyles. We sit around all day, and so get up, exercise, both cardio and weights. Go outside, get sunlight, get fresh air. See nature. Be socially engaged, you know, so meet with people regularly, you know, have conversations in social environments. That's very good for the brain. And then any kind of exercise that stimulates your brain. You know, if you have the capacity, you know, you may want to take up a new hobby, or, you know, learn an instrument or something like that. But also just, you know, simple crossword, word search, you know, puzzles, something that you enjoy doing that actually taxes your mental, you know, capabilities a little bit is actually very good, you know, to do for your brain. There are many other things, you know, sleep quality and toxin, you know, avoiding your exposure to toxins, and of course we could talk for a long time about those kind of things. But the big thing really is, it goes back to what we're putting in our bodies, what kind of food we're putting in. And one of the things that I think is helpful sometimes, you know, my patients can get quite overwhelmed with the sense of like, well, what should I eat? You know, I don't even know what to eat anymore. I hear so many different things, you know, so I give them an example. I say, you wake up in the morning, first of all, you're going to eat very few carbs, and what that leaves is fat and protein, right? That's what's left. So so here's an example. You wake up in the morning, you have scrambled eggs, fried in butter, and you have a piece of, you know, good quality bacon with that. Okay, so here's your fat and protein. And then for lunch, let's say you have a salad with some kind of, you know, dark green, you know, greens of some kind with olive oil, you know, vinaigrette, not a ranch dressing, because that's made out of soybean oil. And then for dinner, you have a steak, you know, from a grass-fed cow, or a cow that was eating things that cows are supposed to eat, and not full of hormones, etc. And a bunch of vegetables, you know, sautéed in coconut oil, and maybe a sweet potato. And then for dessert, you have some whole-fat plain yogurt or a piece of dark chocolate. So all day long, you've not had any sugar, you've not had any sweeteners of any kind, you've not had any carbs. And if you can do that for a month, you're going to start losing weight very quickly. If you can do that for a year, you're going to start putting your, you know, your diabetes in remission and your high blood pressure. I mean, you're going to feel better, and eventually you're going to have, a lot of people find that very difficult. Like they sort of compare that to what they currently eat and think, I could never do that. You develop a taste for clean eating, you know, and you will eventually, that's all you're gonna you know, want, and you're gonna know how your body will tell you this is good, keep doing this, and you'll benefit from that.
Yeah, I was actually about to ask you that. Like, does your taste kind of alter? So that's really interesting.
It does. It literally, and the way it does it is really fascinating. It does it through your gut microbiome. So your gut has a host of bacteria that literally communicate directly with your brain. Your gut has its own nervous system that is physically connected to your brain, and either through that system or through the bloodstream, your gut will literally tell you that what you're doing, what you're eating right now, this clean eating is good. Keep doing this.
That's awesome. Really have a lot to learn when it comes to nutritional and brain health. Well, we thank you so much for joining us again this morning, Dr. Maljares, and all your tips and I wouldn't say tricks, but mainly your tips for nutritional brain health. So thank you so much for being here.
Thank you for having me.
Yes, sir. All right, we'll be right back after the break.